Welcome to Nursing Survival. Find me at nursingsurvival.com for nursing-related study guides, as well as a guide that goes along with this podcast. I have study guides that keep you engaged while you listen, and I also have fill-in-the-blank as well as coloring pages. Today's topic is angiotensin-converting enzyme inhibitors, or ACE inhibitors. This is a very common cardiac medication that you will need to be familiar with. ACE inhibitors work by blocking the conversion of angiotensin 1 into angiotensin 2. Angiotensin 2 is responsible for vasoconstriction, the release of aldosterone, the release of vasopressin, and ventricular thickening or enlargement. Aldosterone is a steroid hormone that influences sodium and potassium levels. Vasopressin is an antidiuretic hormone that acts on the kidneys and blood vessels. It controls urine output and causes vasoconstriction. Some examples of ACE inhibitors include benazepril, captopril, lisinopril, and ramipril. They often end with pril, P-R-I-L. ACE inhibitors work in the body by decreasing cardiac output, decreasing stroke volume, which is the volume of blood being pumped from the left ventricle. They reduce arterial and venous pressure and ventricular after and preload. They also increase sodium excretion in the kidneys. Remember that water follows salt. They cause vasodilation and increase the sympathetic nervous system influences. A very important effect that ACE inhibitors have on the body is increasing the compound known as bradykinin. This is the cause of many ACE inhibitor side effects. Bradykinin causes dilation of blood vessels, but contraction of smooth muscles. This includes smooth muscles in the airway. It is important to remember that ACE inhibitors affect the cardiac system as well as the kidneys. ACE inhibitors are used in the treatment of several conditions, including hypotension, congestive heart failure, and myocardial infarctions. This is due in part to their ability to vasodilate or relax the blood vessels. It also decreases water reabsorption by the kidneys, which helps decrease blood pressure as well as decreases the workload of the heart. It decreases the sympathetic nervous system influences. The sympathetic nervous system stimulates the body's fight or flight response. Diabetic patients are at a high risk of developing diabetic neuropathy. Diabetic neuropathy is nerve damage due to high blood sugar levels. High blood pressure can contribute to the worsening of neuropathy. ACE inhibitors increase the body's sensitivity to insulin, which can help lower blood sugar. They have been shown to prevent or slow the progression of diabetic neuropathy. ACE inhibitors have also been shown to improve kidney function due to their ability to vasodilate the vessels of the kidneys. This helps improve their ability to filter waste, water, and toxins. Patients who are at risk for strokes or who have a history may benefit from ACE inhibitors. They cause vasodilation of the vessels in the brain. Side effects are important to remember as well as why they might occur. ACE inhibitors can cause hypotension, which is normally defined as a blood pressure less than 90/60. A dry, persistent cough is a side effect often linked to ACE inhibitors and is seen a lot on tests. An increase in bradykinin levels causes the cough. They also cause hyperkalemia, which is a potassium level greater than 5. The normal range for potassium is 3.5 to 5. ACE inhibitors decrease aldosterone, which is responsible for the excretion of potassium in the kidneys. Hyperkalemia can cause damage to the kidneys. Headaches are another side effect often linked to vasodilation. Angioedema is a swelling that can occur in the face, tongue, airway, eyes, and body. It can occur fast or slow. In severe cases, the airway may become compromised due to the swelling. Angioedema is caused by ACE inhibitors due to the increase in bradykinin levels. It can be life-threatening. Other side effects include dizziness, lightheadedness, fatigue, weakness, drowsiness, nausea, vomiting. Patients report an abnormal taste, metallic or salty, a rash, and photosensitivity. Kidney impairment is another side effect. I know I said that ACE inhibitors are used in the treatment of kidney diseases, but it is also dependent on what is causing the damage to the kidneys. The reduction of aldosterone influences potassium levels and can cause hyperkalemia. Other electrolyte imbalances can occur. This can lead to kidney impairment. Side effects often seen on tests include angioedema, cough, and hyperkalemia. ACE inhibitors can have interactions with other medications. Potassium supplements can cause excessive potassium levels. Remember, hyperkalemia is greater than 5. Salt substitutes may also contain potassium, which can lead to excessive potassium levels. When taken with lithium, it can cause increased lithium effects. Lithium is used to treat a variety of conditions, including bipolar, schizophrenia, and major depressive disorder. Some symptoms may include tremors, diarrhea, and uncontrollable movements. Aspirins and NSAIDs can reduce ACE inhibitor effects. Diuretics can cause hypotension. ARBs are another cardiac medication. When taken with ACE inhibitors, hypotension, hyperkalemia, and increased renal impairment may occur. Antacids decrease the bioavailability of ACE inhibitors. Bioavailability is the amount of drug that is absorbed. Capsaicin is often found in creams for pain relief. It is the active compound in chili peppers. When used with ACE inhibitors, it can increase the risk of cough. Alcohol can increase depressive effects. Some nursing considerations for administering ACE inhibitors include monitoring potassium levels. Potassium is responsible for impulse conduction in the nerves and muscles. Hyperkalemia can lead to muscle weakness, impaired cardiac function, and palpitations. The normal range for potassium is 3.5 to 5. Captopril has a shorter duration and an increase in adverse effects. It can pass through the blood-brain barrier. Monitor blood pressure before administering. Hold if the patient is hypotensive, which is a blood pressure less than 90/60. Monitor the heart rate before administering and hold if the patient is bradycardic, a heart rate less than 60 beats per minute. The patient should have daily weights. ACE inhibitors can increase fluid excretion. Monitor fluid input and output. Patients of African descent are more likely to develop a cough and adverse reactions. Labs to consider include BUN, potassium, creatinine, SAT, ALT, and bilirubin. BUN's normal range is 9 to 24. Potassium, 3.5 to 5. Creatinine, 0.75 to 1.5. AST, 10 to 40. ALT, 7 to 56. Bilirubin, 0.3 to 1. Patient education is important with any medication. Instruct your patient not to take potassium replacements, salt substitutes, or eat foods high in potassium. This increases the risk of hyperkalemia. Diet questions are often seen on the NCLEX, and my nursing school had a ton of them. Knowing examples of potassium-rich food could benefit you. Some examples include bananas, spinach, potatoes, tomatoes, dairy products, tuna, beans, bread, and pasta. Educate your patient on the importance of not drinking alcohol while taking this medication. Tell the patient to report a cough. This could be the first sign of a more serious complication. Report swelling or edema that can occur in any part of the body, not just the face. Inform them that it could be life-threatening and that they should report it as soon as possible. Instruct them to get up slowly due to dizziness or lightheadedness. If the patient is from African descent, alert them that they have a greater risk of developing a cough or angioedema. ACE inhibitors are contraindicated in patients that are pregnant. They have been linked to birth defects and an increased risk of fetal renal damage. If the patient has impaired renal function due to factors such as electrolyte imbalances, they should not take ACE inhibitors. Patients that have had previous angioedema should not take ACE inhibitors. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for more study guides. I'd love to hear from you. Please send me any topics you'd like to hear. More study guides will be coming out weekly, so join my email list. We'll be having special promotions and giveaways. Thank you.